Doctors, what's your weirdest case of a patient accurately self-diagnosing? Story 1. So, some backstory. Not a doctor, but really who is in this thread. In 6th grade, my best friend had his appendix burst in the middle of the night. After hearing about it, I was utterly terrified of it happening to me. My parents and doctors all told me it's relatively rare, and if it did happen, there really isn't anything to worry about. I asked what it felt like if it did happen, and they said, "Oh, you'll know." Yeah, thanks, really helpful. But my appendix bursting became somewhat of a phobia of mine over a decade. Every time I felt abdominal pain or severe gas, I always jumped to the conclusion of appendicitis. So about 10 years later, I'm hanging out with my friends when I start to feel some bad gas pressure coming on. Nothing too bad, but nothing would really make it go away. After I got home, it was still rather bad, but I figured I'd just sleep it off. Woke up at about 5 a.m., curled into a ball, throwing up in my pillow. At this point, I was still living at home with my parents, so I hobbled my way to their room and woke them, telling them I think my appendix was going. They told me, "It's probably gas, and are you really sure we should take you to the ER?" I told them I was sure it was my appendix, and they sort of told me to wait it out until 7 when they could phone the family doctor. So I curled into a ball in the bathroom and threw up for a few hours. At 7, on the nose, they called the doctor, and I described the symptoms, and the doc told my parents to take me to the ER now. So we get to the hospital, and I'm walking so hunched over, my face is almost at my knees. Bring me into the ER, and they order a CT scan. Think it was a CT, was kind of out of it, and put me on some kind of killer anti-nausea pain meds. The endoscopic surgeon comes in with my CT scan and tells me verbatim, "This is the most clear-cut case of appendicitis I have ever seen," and asks me to sign a release because he was going to film the operation, endoscopic bits at least, for training materials. So long story short, I had appendicitis, I knew it, and it was so clearly appendicitis that the doctor wanted to film it to teach other surgeons. So for any aspiring endoscopic surgeons in the thread, maybe you get to see inside me. Wow. Does that seem like every hypochondriac's dream to be proven so right that the doctors declare you a textbook example? I think this person was able to kind of, hopefully jokingly, hold it over his parents' heads for like years after that. Story 2. Not a doctor, but a chronic patient. I have a rare neurological disease that causes tumors to grow on the nervous systems and on any other type of body tissue, but the nervous system tumors are most common. I was diagnosed at age 4. I've been treated by the same clinic for over 25 years, having seen the same specialist for 20 of those years. The hospital where I'm treated is more than 3 hours away, but my local hospital is affiliated with them. I woke one morning with severe hip pain, swelling in my thigh, and a terrible limp. I went to my small-town ER, where I was told I had a skin infection. Doctor just visually examined me, ran no tests, and told me it was razor burn from shaving my bikini area. Was given an antibiotic. My disease is in my medical records, which the hospital had access to since it's the same medical facility, just different locations. 2 days later, the entire inside of my thigh had turned purple and blue. I couldn't walk without excruciating pain. I went to an express care, like a step down from the ER. They immediately sent me to the ER for symptoms of a blood clot. The on-call doctor notified the ER I was coming, demanding an ultrasound. I arrived back at the ER, where the ER doctor basically told me she wasn't ordering an ultrasound because it wouldn't find anything. Was told the bruising was self-induced to get pain pills, and that I was being discharged and blacklisted. My husband flipped and demanded an ultrasound, threatening legal action if not. Dumb doctor gave me attitude but eventually ordered the scan. The ultrasound tech turned white as a ghost, quickly turned off the monitor and rushed to get the doctor. Turns out I had a tumor the size of a 12-ounce soda can growing off a major nerve in my groin. I somehow strained the muscles around it, damaging my nerve and muscle. Never got an apology or admission of being wrong from the doctor. My specialist later told me she had a lot of fun talking with the ER doctor, with heavy sarcasm. It's sad that your husband needs to threaten legal action for you to be taken seriously, dang. I don't know if this one is so surprising to anyone except the ER doctor. This person, it says in the story, has been treated for over 25 years. I would think with all that time, she would be more in tune with her body and what her symptoms and her disease are than anybody else. Just another doctor who just thinks he knows better than anybody. Story 3. I'm no doctor, but this is something that happened to me. Earlier this year, I got sick. Seemed like the flu and felt absolutely horrible. Once I got healthy again, I started getting bruises for no reason and would get really easily winded just from brief exercise. I'm pretty in shape, so this was odd to me, and needless to say, concerning. Of course, I Googled what I was feeling, and WebMD was telling me I have cancer or a blood problem. Of course. I ended up seeing 4 different doctors who all told me that I'm paranoid and just need to relax. But I couldn't shake the feeling that something was wrong. Finally, the 5th doctor I saw said she'd give me a blood test to calm my nerves. And the next morning, I get a phone call in my dorm room saying that there's a bunch of things wrong and that I needed to go to the hospital. When I asked what that could mean, they told me I could have leukemia. Needless to say, the scariest moment of my life, as I'm only 20. Long story short, months of doctor's visits and eventually a bone marrow biopsy revealed I don't have cancer, but a rare blood disorder called aplastic anemia, which causes your bone marrow to stop making cells. I'm happy to say after extensive treatment, I'm doing well now, but it's very freaky to me that it took 5 different doctor's visits to finally hear me out when I felt something was wrong. I understand that these doctors probably deal with whiny people who exaggerate everything, but you can't get complacent when people's lives are on the line. Something should have immediately started ringing bells if you mentioned that you were getting winded with a little exercise and bruising easily. My goodness. Yeah, 5 doctors just to get a blood test. I would think that with the U.S., with everything going on with how we pay for our health care, you might have come across at least one doctor who would have just been happy just to get the extra money from doing a blood work or something, if not just to get the real answer. It's very messed up. Story 4. Not a doctor, but this happened to me. When I was 8, I was having severe headaches. Like it felt like someone was constantly stabbing me in the eye. My mom, who's an LNA, suspected it was nothing more than a sinus infection. She took me to the doctor to get checked out and get put on antibiotics, but they were adamant that it was not a sinus infection. They claimed I was too young to get one of those. For the next 2 weeks, I was in the hospital every day where they were running all sorts of tests, trying to figure out what was wrong with me. They checked out my eyes, checked out my urine and blood, but couldn't find anything. The whole while still had severe headaches that were progressively getting worse. Finally, they suspected that I potentially could have a brain tumor. This scared the daylights out of me and my family, as my grandfather died of a brain tumor before I was born. They ran a CT scan to check, but they failed to find a tumor. What they did find out, however, was that my sinuses were severely inflamed. And I had a horrible case of sinusitis that needed antibiotics to treat. Once in antibiotics, I felt better within 5 days. After that, we started going to a different doctor. Too young for a sinus infection at 8. Wow, that's so insanely ridiculous they thought that wasn't a possibility. I had my first sinus surgery at 8 because I had chronic sinus infections and headaches for years. I then had another at 10, and last year I had one more at 27. I'm glad yours wasn't something worse at least. Story 5. Not a doctor. I had gallbladder problems some years back and went to the doctor. He said my blood work came back normal and that it was probably either indigestion or a sprained muscle. I told him I knew it wasn't. He asked me what I thought it was, so I told him I was certain it was my gallbladder and that it was full of stones. He told me, verbatim, "You're not middle-aged nor overweight, so it can't be that at all." I told him rather sternly to order the ultrasound because I was very certain he was wrong about what he thought it was. Half-hour later, I'm laying there getting the ultrasound done when the tech was all, "Yeah, so I'm not supposed to tell you anything, but I'm going to anyways. That is a fat sack of stones. I've never seen a gallbladder this bad before." My gallbladder was full of large and small stones. I cried and thanked him, then cried more because I was so angry with the doctor and the nurse practitioner and the previous nurse practitioner I saw a few months before that appointment for the same pain, who wrote it off as a strained muscle in my back. After the doctor saw the ultrasound, he came in with a nurse practitioner and 3 other nursing students to tell me I was right and to give them a lesson on listening to patients and to not just brush off their concerns and suggestions. Almost 2 weeks later, I was in for surgery. Good grief, this turned out longer than I expected. Good on that doctor for acknowledging his near mess-up. Story 6. For 16 years, I complained about severe pain, loss of blood, listlessness, and extensively long periods. We're talking 13 to 17 days. I kept getting told that it's normal. I'm exaggerating. It can't be that bad. I must have a low pain tolerance, etc. I tried every single form of birth control over those 16 years. In 2008, I had exploratory surgery since my GYN couldn't figure out what was wrong. Turns out that I had severe ovarian torsion, which they repaired, and they also found quite a bit of endometriosis and removed it. I still had heavy long periods, but the pain wasn't as bad. Then the pain started coming back in 2015. After several ER trips, I finally get an appointment with a new GYN. I said I was tired of this junk and wanted a hysterectomy. She said before doing something so drastic, she suggested trying an IUD. So I did the Mirena IUD for a year and got such bad depression from it I wanted to unalive myself, on top of horrid pain any time I had intimacy, and with months of constant bleeding. Then, this past June, my GYN agreed to do a hysterectomy. I was full of endometriosis, adhesion, and cysts. I was having bladder incontinence problems because my bladder was completely surrounded by the endometriosis. Now, I am 3 months post-op and so glad to be free from all the pain and bleeding. Plus, the bonus of never having to worry about an unwanted pregnancy. That's horrible. I'm glad you're finally in a good place. I have to say, as a guy who really doesn't know the extent of the pain women have to go through for that part of their health, that just reading about that scared me. I don't think any guy would really be sane having to face some kind of pain that said, hey, we got to remove part of your reproductive parts or reproductive ability. No, guys would go insane. Story 7. Not a doctor. I self-diagnosed rhabdomyolysis, had the whole Coca-Cola covered pee thing, and went in and explained to him that I thought I had it. Couldn't pronounce it, wrote it down and showed him. Doc kinda laughed a little and said, "Man, this internet thing is not doing anyone any favors." This was in 2005. He says, "Pee in this cup so I can prove to you that you don't have it." I pee in said cup. He takes a look, says, "Wow, I don't even need to check this under a scope. I need you to go to the ER right now. Don't go home. Someone can bring your stuff later. Go there right now. I'm calling them. They will admit you as soon as you show up." Sure enough, spent 3 to 4 days in the hospital with constant full open IV drip having to measure all my output until some level, creatinine, got back into normal levels. Apparently mine was like 1,000 times higher than it should be. How did I get this horrible thing, you may ask? I went to a gym, told the guy, "I've never really worked out before, but I'm getting older and need to get in shape." Turns out, when you're a younger athlete and stop working out, you might still be able to go at it harder than your body can handle, and you break down way too much muscle fiber and end up clogging your kidneys. Yay! I love this one. Man, nothing wrong with... No, wait, you're very close to unlife. My bad. Story 8. Picked up a long-term patient at county hospital who is both epileptic and schizophrenic. And she told me her history with incredible insight and understanding. The reason she was there was because she was on Dilantin and meds for her schizophrenia. So she said, "This is what happens. I'm taking all my meds, but I begin to cut back a bit on the stelazine for schizophrenia. Then I get a bit more paranoid and figure I'm being poisoned with the Dilantin, so I cut back on that, and I have a seizure. That cures my paranoia for a while and start taking my Dilantin and stelazine again. But then I get paranoid and stop taking as much of the one or the other, then get more paranoid, stop my Dilantin, get a seizure, and end up in here." She knew exactly what was going on. Incredible insight. And her records showed she was right. Incredible insight into what was happening, but completely powerless to stop it either. The seizures made her sane a while, and things would balance out, and finally, a few times a year, she'd end up in hospital because it would get out of control. As a psychiatry resident, I love ECT for this reason on my psychotic patients. It's so neat, and it works so well. Interesting to hear about schizophrenia patients with insight. It's unfortunately not as common as I would like having a patient agree with my assessment that they're suffering from psychosis. Story 9. Sorry, I'm not a doctor, but last year when my daughter was 3 months old, she stopped eating and pooping. Then she started getting weak and limp, and it got to a point where she couldn't even open and close her mouth and eyes. ER doc said she was dehydrated and put her on an IV overnight. The next morning, she was worse. How are you worse, but not unalive yet? I don't know. Anyway, I read a New York Times article that was meant to be a riddle for medical professionals. And the riddle described my baby to a T. Most of the commenters guessed infant botulism, so I suggested it to the pediatrician that came in the next day. He said, "No, she's probably still dehydrated." That immediately made no sense. "And she'll be fine. We can go home." Mind you, we live in New Jersey, and this was in North Carolina. We were on the way back home from a road trip to Florida. I wasn't having it. We asked to transfer to a children's hospital. The docs there did every test they could think of, and nothing was coming up. I begged them to test for IB, and gave them full permission to laugh at my lack of medical expertise, and since they already tried everything else, they obliged. It was IB. The first case that hospital had seen in 20 years, I think. The residents on her case wrote a paper about her. Again, a story so on the money, the doctors write a paper about it. I guess this guy is going to have bragging rights for years, and especially with a little bit of seriousness considering this was his infant daughter. Yeah, he is going to be insufferable. Story 10. Not the doctor, but the patient. I went to the ER with excruciating pain that I knew was kidney stones. I was vomiting and unable to move without help because it was so immobilizing. Doctor wouldn't listen and kept trying to insist that it was just a pulled muscle in my back. My mom, a nurse of 30 years, demanded an ultrasound as so far they had done no testing but palpating the area. He was stubborn and absolutely did not want to waste time. She threatened to report him for negligent patient care. I was literally puking into a basin as they stood on either side of my bed arguing. He finally caved in and reluctantly sent me to get the ultrasound done. Wouldn't you know it, a stone was completely blocking my left ureter, causing a fluid buildup in my kidney, which in turn caused my kidney to swell up. They were able to get the stone out and get the swelling under control, but the ER doc refused to look my mother in the eye or acknowledge her after she proved him wrong. Good on your mother for advocating for you. She sounds like a great mom and a fantastic nurse. That ER doc sounds like one of those guys who's dismissive of nurses when they're the ones who are with the patients the most and can give the most accurate info for someone in their care.
Please like and subscribe if you've made it this far. I hope you'll enjoy the rest of the video and have a wonderful day.
Story 11. Not a doctor. Every time my wife had a little discomfort in her belly, she'd worry that it was ovarian cancer. She'd tell me that her worst nightmare was dying of ovarian cancer and leaving me with 2 young kids. And every time I'd tell her she was being silly and morbid, to try to comfort her so we could both go to sleep. Years go by and she starts getting real pain. Turns out her gallbladder is swollen and they remove it. So I tell her, see, it was your gallbladder all this time. But the pain doesn't go away. The doctors tell her it's from the surgery, but it gets worse. Eventually, she gets an MRI and it's ovarian cancer. 3.5 years of struggle later, and she expires at 50 of ovarian cancer. I kick myself for not taking her fear seriously and doing what I could to have found the cancer years sooner and possibly saved her life. She never worried about breast cancer or cervical cancer. It was always ovarian. I think that maybe your body tells you things and it shows up in fears and dreams and who knows how else. But maybe we should listen more carefully. I'm so sorry. That's awful. Hope you and your kids are doing okay. Story 10. Also not a doctor, but it happened to me. Went to the doctor because I found a little hard spot on my testicle. It felt like a little hard seed on the side of one testicle. Definitely something new and weird, and it got me concerned. I go to the urologist and tell him I have something weird on the side of my testicle. He's confident I'm just feeling my epididymis. And I'm an idiot. He just keeps giving me biology lessons on what's inside a testicle. I tell him, no, I know what you're talking about. This is not it. It's hard to find it and feel it, and having a doctor twiddling my testicles between his finger and thumb was not really getting anywhere. He suggests an ultrasound. I go to get the ultrasound. The technician asks what I've been feeling. I explain. She is also convinced I'm just feeling my epididymis. Here we go again. I explain. She scans my spheres. I go home. Doctor calls later that week. They found a calcification outside my testicle, and that's what I felt, but it was also no big deal and only to worry if it grew. Yeah? So it wasn't my frickin' epididymis? A lot of people got to see her testicles. Story 13. Not a doctor, but I started having painful abdominal spasms, and I was sure it was my appendix. I have a very high pain tolerance, so for 2 days I was still carrying my heavy toddler and working out. I told my husband and family, and they wouldn't believe me and told me it was just gas, but I knew something was wrong. Anyway, I decided to go to the hospital. Despite my husband's protests, I was making a big deal. The doctor didn't believe me. They sent me for a vaginal ultrasound because she thought it was probably an ovarian cyst. I was ticked they weren't believing me, so I let them give me the ultrasound anyways. Came back negative, and they were about to send me home. Decided to make my husband drive me to another hospital. Everyone was ticked I was making them waste their time since my husband had to miss work and my mom had to watch our son. Anyways, turns out I had appendicitis and my appendix was about to burst. Doctors said if I would have waited a few more hours, it would have burst. Had surgery within an hour of showing up. I was ticked at everyone that didn't believe me. Story 14. My dad, who is a great person, but also occasionally a butthole, took my 3-year-old sister to the ER with the flu. The thing is, there was a meningitis outbreak in the area, and the ER was packed. Dad, being a jerk, tells the nurse he's suspecting meningitis to bump us to the top of the list. The doctor is ticked because she has no meningitis symptoms, no stiff neck, no fever. They get into an argument. He orders a spinal tap since Dad is concerned. Dad will not back down at this point. And it comes back positive for meningitis. When I was in 2nd grade, I wanted to get out of class, so I complained about feeling sick even though I felt fine. They sent me to the health room. Check my temperature. Next thing I know, I'm in the ER. Had a temp of 103.9 and walking pneumonia. Story 15. Not about a doctor, but an EMT. When my friend was in college, his appendix burst. He was in extreme pain, couldn't really move, and was acting delirious. His girlfriend called 911 and said she thinks his appendix burst. Ambulance shows up. EMTs think he's just drunk and refuse to take him seriously. They take their time, give lots of attitude, lecture them about underage drinking, all while she is panicking, telling them he doesn't drink and needs to be at the hospital now. She was right, and the EMTs almost unalived him. When I had a stroke in college, the ER doctor gave me a super condescending speech about underage drinking and discharged me. That was after the blood test came back clean. I ended up having another stroke in the 5 weeks it took anyone to take me seriously. Story 16. Not a doctor, but a patient. I woke up one morning with a severe pain in my side, and I instantly knew I had a kidney stone. I'd passed one before. I'm a female, by the way. Couldn't get into my regular doctor, so I made an appointment with the first guy who was available to hopefully get pain meds to make passing it a little more bearable. I go in to see him, and he is hands down the most arrogant and condescending doctor I've ever seen. When I try to explain to him that I know it's a stone, he tells me that since I was able to walk into the office, I don't have a stone. If you had a kidney stone, you wouldn't be able to move. Passed the stone 2 days later without medication. What a butthole. Story 17. Had a patient at the ICU on a ventilator because of rapid lung fibrosis. Usually it's triggered by medication or an outside trigger. Pets, feces of pets, etc. We stopped one of his cardiac medications, which is known for being able to cause this kind of syndrome, and the progression of his disease stopped. We told his wife, and she said, "Yeah, I knew, and I knew it was this particular drug." The dog told me. We were shocked and asked her to explain. She told she had been feeding the different drugs of her husband to the dog over a period of 2 weeks. Every day a different drug, and he had started barking when she fed him this particular drug. I hope people don't actually do this. Story 18. So I fell out of the top bunk on vacation and broke my leg on the lower metal frame. ER doctor said I couldn't possibly have broken it, and I was just trying to score pain meds. His proof? I walked in. 4-hour cab ride back home. My regular doctor puts me in his own car to drive me to the hospital where the swelling on my leg is now too much to cast. Original ER doctor paid all my medical bills and was reviewed by the state board, where it was discovered he had been drinking on the job. Lesson 1? You can walk on a broken leg. Lesson 2? Don't be a jerk. Story 19. Wasn't my own diagnosis, but I went in with my mom when I was 11, and my mom told them I had appendicitis. They were super reluctant to even look at that possibility and assumed the CAT scan was showing them built-up gas. My mom insisted they keep going, so they sent the scan to another city for them to examine, and the docs came back in to tell me that my appendix had erupted and that gas all over my abdomen was toxic pus. If I had been sent home, it would have been a final sentence, since it was already approximately 2 days since it popped. Story 20. I had a patient who predicted her own unaliving. She was a relatively healthy 90-year-old with hypertension and diabetes. She woke up that morning, told her daughter that she was going to pass away. She made her daughter go to a lawyer's office and sign a living will confirming DNR/DNI. That evening, she had a massive heart attack and was rushed to the ER. We tried medical management, but per her wishes, per her living will that she signed like 6 hours earlier, she did not want any invasive measures taken. She passed away about an hour after she came in. Story 21. I was 9 when I fell off my bike on a family bike ride. I was screaming like crazy, say my leg was broke. My parents thought I was crying wolf and told me to walk it off. When I wouldn't shut up, my dad carried me to the parking lot while my mom got the car. I remember my dad telling me to put my leg in a position if I truly thought it was broken, but he was still skeptical. Lo and behold, when we went to the ER to get an MRI, my leg had a spiral fracture. Story 22. During my second lung collapse, the doctor was adamant that it was just a panic attack. Since it felt exactly like my first lung collapse, I kept insisting he take an X-ray. After the X-ray results, he said, "Against all probable odds, you were right," and I had a tube in my chest within the hour. A response like that would have ticked me off. It wasn't against probable odds. You had experienced it before and knew what it felt like. What a jerk. Story 23. Not a doctor, but the Texas shooter diagnosed himself with a brain tumor and no one believed him, despite him going to multiple doctors and begging to be checked. He literally unalived a bunch of people to prove to the doctors there was something wrong with him, and gosh darn it if the autopsy didn't find a giant tumor in his brain pressing on the aggression center. Story 24. Remember that dude who peed on a pregnancy test kit as a joke and got a positive? And online people told him it might have been testicular cancer and how he visited a doctor and it turned out to be testicular cancer? That's nuts. Story 25. Went to the same emergency room twice explaining that something was messed up in my head. They diagnosed me with anxiety attacks both times. Had a stroke 2 days later. Story 26. Had a patient who yelled "Code Blue" really loud from his room. As we all rushed into his room, his heart stopped. He didn't perish that day, fortunately.
Please leave your story in the comments. I would love to make a video on them in the future. Also, don't forget to like and subscribe.